Welcome to today's Explainer. We are jumping right in today because we're unpacking a fascinating and honestly an incredibly high-stakes environment. We're going to dive into why Arkansas County jails are not just, static holding cells with locked doors. They actually operate a lot more like incredibly intense mini cities. These are places that require constant around-the-clock triage, managing everything from general public safety to acute medical care, all while balancing strict constitutional rights against some very real financial limits.
So what really happens inside a county jail? To wrap our heads around this, we kind of have to toss out everything pop culture tells us about local detention. It's not just about locking a door and throwing away the key. It is a massive operational, financial, and logistical puzzle that literally never sleeps. It's a complex system that demands real-time, on-the-fly adjustments just to keep the lights on and stay functional.
It's really easy to just lump all incarceration together, right? But county jails are a totally different beast compared to state prisons. State prisons are heavily state-funded and built for long-term detention, meaning their populations are pretty stable. County jails, on the flip side, are operated locally by a sheriff's office or county government. They're designed for short-term stays, and because of that, they face chaotic, rapidly changing populations. People are constantly cycling in and out every single day. They're awaiting trial, serving short sentences, or just being temporarily housed. It makes the daily management wildly unpredictable.
To make sense of this complex machine, here's how we're going to break it down. 1. The local pressure cooker. 2. The overcrowding crisis. 3. A frontline health clinic. 4. Staffing and financial strains. And 5. Managing the juggling act.
All right, let's jump straight into part 1, the local pressure cooker, geography and system stress.
Geography actually dictates a huge amount of the stress these facilities face. Arkansas has a really diverse landscape of urban, suburban, and rural counties. In larger urban areas, you're dealing with massive intake volumes and incredibly complex populations. But rural counties face their own unique hurdles. They often operate with vastly fewer staff members and have absolutely zero extra room to absorb a sudden spike in arrests. On top of that, rural facilities frequently have to navigate incredibly long transport distances just to move someone to a hospital or an alternate facility.
And that geographic strain feeds directly into our next major pressure point. Part 2, the overcrowding crisis, when the system backs up.
Overcrowding is arguably the single most persistent headache for facility managers. And here's the kicker. It's not always a long-term chronic issue. It is often violently unpredictable. Even if a jail isn't normally over capacity, a short-term surge can create an absolute operational nightmare. A wave of arrests over a busy weekend, a major local incident, or even just a simple backlog in court processing can instantly push a jail way beyond its intended limits. When people get stuck in jail longer than expected because of unresolved charges or a lack of outside placement options, the entire system just backs up.
And when that backup happens, it triggers a really dangerous domino effect. Less physical space means skyrocketing tension. It puts this immense pressure on housing, supervision, and basic sanitation. But crucially, it makes classification nearly impossible. Jails have to separate people based on risk levels, medical needs, and legal status. When you run out of beds, that vital classification system completely breaks down, and that directly raises the risk of fights, self-harm, and major emergencies.
Now, those space issues get a whole lot more complicated when you realize exactly who is coming through the doors. That brings us to part 3, a frontline health clinic, the medical mandate. We don't often think about it this way, but county jails in Arkansas increasingly serve as frontline healthcare facilities. They are often the primary intake centers for people with untreated mental health conditions, severe substance use disorders, or sometimes both. A lot of individuals arrive in active, acute crisis. Imagine trying to run a literal emergency room inside a cell block. Jails simply aren't built or equipped to provide the level of treatment you'd get at a community hospital. Yet, they have a strict, non-negotiable mandate to manage these crises the exact second a person is booked.
This drops a massively heavy burden right on the intake desk. Staff have to instantly triage every single person. We're talking about screening for diabetes, hypertension, asthma, infectious diseases, and severe withdrawal symptoms all at once in real time. If someone is experiencing a mental health crisis, staff have to rapidly initiate observation and suicide prevention protocols. Medical care in custody carries huge legal obligations, so failing to properly document a condition or coordinate with outside doctors isn't just a small oversight, it's a massive liability and a very real safety risk.
Managing that kind of physical space and complex healthcare takes highly trained people and, frankly, a lot of money. Which leads us to part 4, staffing and financial strains, the resource squeeze. Here's the reality check for local governments. The tax budget pie is incredibly tight. County jail management isn't backed by endless state funding. They have to constantly fight for a slice of a very limited local tax base. Every single dollar spent on keeping the jail running is a dollar that isn't going toward other essential local services. We're talking about repairing potholes, funding the local courts, keeping emergency services running, or supporting public works. It's a constant tug of war.
Because funding is so stretched, recruiting and keeping qualified staff is terribly difficult. The job itself is demanding, the hours are stressful, and the pay often just can't compete with private sector jobs. It's actually kind of astonishing. In a smaller Arkansas county, being short just 1 or 2 staff members on a shift can drastically disrupt the entire facility. Suddenly, the jail struggles to safely monitor housing units, escort detainees to court, or even finish basic required paperwork. Just 1 or 2 vacancies changes everything.
And when those budgets are squeezed, administrators find themselves trapped in a vicious cycle. They have to postpone basic facility repairs, like, say, putting off fixing a broken lock. They delay technology upgrades, relying on aging camera systems and really inefficient paper records. That forces the remaining staff to work harder and longer, leading to massive burnout and skyrocketing overtime costs, which in turn leads to even higher turnover. What starts as a tiny budgetary compromise quickly balloons into a very expensive safety risk for both the staff and the detainees.
So how on earth do local administrators keep this whole thing from collapsing? Let's look at our final section, Part 5, Managing the Juggling Act, Systems and Solutions.
Well, the very first thing to understand is that a jail does not operate in a vacuum. Its success or failure is completely tied to the broader justice system around it. If court paperwork moves slowly, if a judge postpones hearings, or if rural transport takes too long to get a detainee to a specialized medical appointment, people end up staying in custody much longer than necessary. That directly drives up overcrowding and bleeds the budget dry. Having efficient, seamless coordination between sheriffs, clerks, prosecutors, defense attorneys, and judges is absolutely essential.
There's no single magic wand to fix all these challenges, but local leaders do survive by sticking to a very rigorous management blueprint. It's all about relentless, data-driven strategy. Good data helps them identify repeat bookings or upcoming staffing gaps so they can actually anticipate the unexpected. They double down on the basics: rigorous intake screening, incredibly clear housing procedures, actually investing in staff training so people want to stick around, and building rock-solid partnerships with outside medical and behavioral health providers.
These aren't just abstract logistical issues. They directly impact the safety and the wallets of local communities everywhere. Knowing that a single weekend arrest wave, or just a couple of staff calling in sick, can alter the stability of an entire facility, we really have to ask ourselves, what are our communities truly willing to fund to keep these hidden, yet absolutely essential systems safe and functional? It's a critical question that local leaders and every taxpayer must face every single day. Thanks for joining me on this explainer, and keep questioning the systems around you.